So while the
Hello,
other day,
friends. I welcome you all to the two-day APAC Local Healthcare India Conclave, a prestigious knowledge-sharing platform to discuss and deliberate upon various aspects of healthcare sector as a whole. For last 2 days, we have been discussing on various aspects of building quality, effective healthcare ecosystem and to take India's healthcare innovation to the next level, to the global arena. In the inaugural, yesterday we had perspective from Department of Science and Technology. We were honored to have as Secretary Professor Ashutosh Sharma, who talked about how Department of Science and Technology is doing its bit to promote science and innovation in the healthcare ecosystem. And he also find that Indian healthcare story is all set to take off in the global arena, especially in the new world order. We also had the pleasure of having with us Dr. Neeta Verma, Director General NIC Government of India, who spoke at length about Arogya Setu app and how Arogya Setu app is changing the game of contact tracing to tackle corona crisis. We also had a perspective from National Health Authority. Dr. Vipul Agarwal was with us. He highlighted integration of digital health mission with Ayushman Bharat and how technology is being leveraged by National Health Authority to streamline processes. We also had a perspective from Dr. Nitin Madan Kulkarni, Principal Secretary Health and Family Welfare Government of Jharkhand. And he also talked about mental health and also changing the behavior of us. That will be a big challenge to tackle corona. Also, we had a perspective from Managing Director HSCC India Limited, Mr. Ganesh Pandey, who spoke about how HSCC is building world-class hospital infrastructure in India and neighboring Asian countries. That session was followed by a special presentation by Jayat Singh, CEO Gwalior Smart City Limited, and how technology is being leveraged by Gwalior Smart City to tackle corona crisis and how they're using technology innovation for contact tracing and all those things were discussed there. We also had a session on mental stress and how this mental stress can be addressed, how more importance should be given on mental stress. Also, we had a session only on healthcare startups with angel investors. They showcase some innovation in healthcare spectrum. Also, we had a session on medical device manufacturing sector in India. What are the challenges and what are the opportunities for new world order? Today, we also had two different perspectives from the hospital fraternity. One, how hospitals can engage new patients, allay out fears of new patients, and bring back patients who are not COVID patients to hospitals. So we had eminent speakers in that panel. Also, we had a session on how hospitals can convince, how hospitals can also realign their model of running the hospital in the new world order with their sustainability model in mind. And also, just before this session, we had a session on how cost management can be done for the new world order in the hospital management. These were all discussed. Also, we had two presentations from Medall and also from MedStrat and also from Godrej Appliances. They give an industry perspective. And now we have a very important session of local India healthcare conclave, a session on how COVID-19 changed or changing the Indian healthcare technology landscape and what is the way forward. And for this, we have an eminent list of speakers with us. Let me introduce you Mr. Nanda Kishore Domne, VP IT and CIO Manipal Hospitals. We welcome Mr. Nand Kishore. He'll
Thank
be
you.
moderating the session. We have with us Dr. Naresh Yalabragada, CIO KIMS Hospital. We welcome Dr. Naresh. We also with us
Hi,
have
good evening, everyone.
Nilesh Shinde, CTO Jupiter Hospital. We have with us Mr. Abdullah Salim, Group CIO Omni Hospitals. We welcome Mr. Salim. We have with us Mr. Harmandeep Singh, VP IT Rainbow Children's Hospital.
right, good evening, everyone.
And we also have with us Mr. Jay Prakash Dwivedi, CIO Rajiv Gandhi Cancer Institute and Research Center, Delhi. I welcome you all for this very special session on how The new world order is witnessing a massive technological transformation in Indian healthcare ecosystem. What is the present? What is the future? Let me also take this opportunity to thank our partners for this special conclave. Our government partners, Department of Science and Technology, Digital India, MyGov, NIC, BSU partner, HSC India Limited, Gold partners, Innovantage and Medall, associate partners, Godrej Appliances, TrackMed, Omni Hospitals, MPS and Acumen Today, institute partner, IIHC India, and investment partner, Indian Healthcare Angels. With this, I hand over the session to Mr. Nankishore Dhomne, VP IT and CIO, Manipal Hospitals. Over to you, Mr. Nankishore.
Thank you very much for setting the context and giving a wonderful introduction to the panelist. It's my immense pleasure to be part of this panel as a moderator today. And let me say good afternoon to everyone. Good afternoon to ladies and gentlemen. We all know that the COVID pandemic is considered as the most crucial global calamity of the century. And also it is the greatest challenge that the humankind faced since the World War II. We all know more than 200 countries have been affected with COVID, and it's a global crisis situation today. Having said that, in India, we have reached almost 32 lakhs cases, and if you have seen the today's news, we have 70,000 cases reported in a day, which is a new peak. And every alternate day, that peak is actually going, to a different level. So this is a crisis situation. And due to COVID-19, almost every industry is affected. With the continuous lockdowns and restrictions on free movement, there is a major negative impact on demand and supply, which has affected the revenues and profitability across the industry verticals. The job losses, pay cuts, etc., are putting a sense of insecurity and a major stress among the people. I was reading one news recently, and there are almost 41 lakh jobs people lost during COVID situation. Coming to the healthcare industry, which all of us, we represent, okay? Healthcare industry too is going through a tremendous stress. They're going through a serious existential crisis, which were never seen before. Organizations are finding it difficult to sustain the operations due to huge fall in patient footfalls, revenue drops to almost 70 to 80%, additional costs due to the safety of the care team and doctors, staffs, etc. There are supply chain issues, work from home constraints, and there is also, fear psychosis in the patients. Even if the situation is kind of improving, but then patients are not coming to hospitals. They don't want to come physically to hospitals. Against the backdrop of these challenges, we are today having this panel to discuss as to how technology is playing an important role, okay, to deal with this unprecedented situation. Now, we are all hearing digital everywhere, right? I was personally part of a couple of panels, and we discussed these things there. And with every panel discussions, I'm getting more and more insight as to how the CIOs of healthcare industry are trying to, deal with this situation. There are new ways of technology implementations they are doing. The question today to the panelists are, how the present COVID crisis ultimately proving to be a watershed moment for Indian healthcare street technology. Has COVID really pushed the digital adoption with a major boost across all the stakeholders in healthcare industry? That's a question we are trying to address today. So when you come to the healthcare industry, we have various stakeholders within the hospital. Okay, it starts with the doctor, nurses, the paramedics, patients, the hospital operations team, management team, the support functions like supply chain, finance, etc. So my question to the panel is that, considering the current crisis situation, and these are the various stakeholders which I just now explained to you, how did you manage your journey during this crisis time? You might have done a lot of technology implementations. You might have had challenges in terms of adoptions. You had challenges in terms of work from home, sort of technology not being in place. So I wanted, the panel to kind of share one by one their success stories, give the examples, narrate about your challenges, and also do mention to the audience what is the way forward. because this is also an opportunity. What is the future potential of these technologies? So let me begin my question with Dr. Naresh. Okay, if you can share with us as to how was your journey through COVID and what is the way forward you look at. Over to you, Dr. Naresh.
Thanks, Nandakishore, and thanks to the organizers for this wonderful opportunity. We've been, me and Mr. Nandakishore have been in similar panels earlier as well, where the same topic was being discussed in terms of what is hospitals, how did it change ever since the pandemic struck in India. Maybe I can give a perspective of or the experience what we had at KIMS. From the moment the lockdown was announced way back in the month of March, what we've seen is complete, a situation of chaos, as Nandikishore also said, because we were not sure of what we are getting into, right? More both from a delivery of healthcare perspective, both from an operations perspective, both from a clinical care perspective, everything was in chaos. So patients were not coming to the hospital because there's a pandemic. Operation staff were not coming. Obviously, my team members, IT also were kind of, everybody was staying at home and saying they were worried of coming to a hospital. In such a chaotic situation, our focus, why we work in a hospital, should not take a back seat. Right, our hospitals are to deliver healthcare services, to take care of patients. That was a focus which we've never thought of losing. So because of which, that's where the whole the focus of digitization and digital health has come into the picture, right? It's not that every hospital doesn't have an IT or a digital strategy, but what I feel is because such pandemics really help the management to look at the adoption of technology to continue serving patients. At least for KIMS, I think because of the lockdown, or at least now we're on August and late August, we see that still patients are little worried to come back to a hospital. Still doctors are worried to come back to a hospital and treat patients because of the pandemic which is there. Because of which we had to rely or search for some technology through which we can continue delivering healthcare services to patients. So we had inpatients, we had outpatients. All of those patients had to be taken care of. So telemedicine and having an application which could help our doctors treat them is one of the areas where we have concentrated and started using such platforms to continue delivering services. That's what we've done for treating patients. But as far as the manpower and the productivity goes, we had a lot of challenges because none of them were ready to come back to a hospital and work. Primarily the housekeeping staff, primarily the operation staff. Everybody were kind of scared, and we had a lot of people who have just absconded just like that without any notice or anything like that. That's where from a housekeeping and a operations deliveries perspective, we had kind of continued to use the platforms which we are already using before. But I think that those platforms really helped us to understand how many actually people we would need on the ground to take care of patients. Right, that's give a different focus to ensuring the services within the hospital is taken care of. So I would say broadly, one is the challenge of continuing delivery of healthcare services, but that was a challenge through which we have used, telemedicine as one of the platforms. Continue doing that. Second is whatever productivity is there within the hospitals, we try to use some of the technologies within the hospital to ensure services are taken care of. One of the examples is what I've said, the housekeeping staff and the technology we've used to ensure services are not hampered.
All right. Quite interesting. Thanks, Dr. Naresh. I think I get your key points. And you mentioned very clearly that the manpower related concern, the productivity, and especially some people absconding because of the fear factor. I think that was one important takeaway other than the technology related challenges, what you mentioned. Let me now bring a perspective from Nilesh. Nilesh is actually a CTO from Jupiter Hospital. So Nilesh, can you please share your thoughts on this?
Yeah, thanks Nankishore, and thanks organizer for giving this opportunity on this platform. So I would like to tell you, okay, we are hearing about digital health. Years together, for last few years, we are hearing about that digital health. If you see our hospital ecosystem in India, it is multi-layer architect. So it is divided between a private hospital, then a government hospital, then a rural or maybe a urban hospital, then lifestyle diseases. So always there is a scope for digital health, because when there are a lot of challenges are there, there is a lot of scope is also there. So in India we are having this challenge scope for the digital health, and everyone was prepared for that. That in next few years to come, we have to really look into digital health seriously. And if you see that in somewhere around December 2019, we came across globally there is an issue with the COVID. So same thing has happened in Maharashtra also. On 20th March 2020, the lockdown was announced in Maharashtra, and it was everything was so sudden that we came to know, like in our Jupiter hospital, the management, including the chairman and MD, we decided that this is a crisis situation. Now this COVID is not going to go immediately. It is going to last for at least for few months. So now what to do? It is like a war-like situation, and you have to fight on all the fronts. You cannot say that we are there ahead of some front and we are lagging in some front. Cannot happen. So for doing that, we should have a good solution for all the queries which will be asked by our own staff, communication, as well as there should be a seamless execution. Now, when we are saying that there is a situation like a war, then we have to first take care of our frontline warriors. So who is our frontline warriors? Frontline warriors means nursing staff, housekeeping staff, then there is security guys who are there on frontline along with the doctors. So we have to take care of them first, and then we have to also take care of the patient also. So that is also important. So how we can do it? So there the technology comes into picture. Now, normally we use for WhatsApp or some other chit chatting also. But here we have done that. We have made one action group. An action group is whom? Those are like top management, then general administration, medical administration, hospital infection control team, HR will be there, nursing, operation team, as well as technical service team. So there is a one action group was done. Now, what the action group has to do? Action group has to take care of the safety of the employee, as well as they have to follow the ICMR and WHO norms, as well as the local norms of the municipal corporation, along with the HIC implementation. So first thing, like we have introduced, everyone is aware about the terminal SMS, short message service. But what we are saying or what we have introduced is sanitizer, mask, and social distancing. That is important, SMS. Now, for our own staff, we have to do the screening. Now, the main question was that everyone was talking that everyone should have PPE. But the important was that how to use that PPE, how to use it, how to wear it, how to remove it. That is called a donning and doffing. And then when I am saying donning and doffing, then we should have a good space for that donning and doffing area. Now, what is the important that when it was totally locked down in Mumbai, there was no train facility. So how our own staff will reach to hospital? That was the concern. And then our HR department has really active so fast that they have taken care of accommodation, transport, travel days, everything. Now, important was that can we have a flexible work hours for our own employee? And we said, okay, those who wants to work for 12 hours for 4 days and then take a break of 3 days. So that is also possible. For nursing, what we have done, instead of 8 hours, they can work for 6 hours on PP, then take a good break. Again, they can work for 6 hours. So this we were doing for the employee. And then we realized that, oh, this everything we have done till 30th of March. But then we realized that our patient people have started going down. So now what to do for patient safety is also important. How their confidence will come up. So first thing we have done is that we have started fever OPD. Then whichever patient will come on the casualty side, what we have done is that the triaging will happen at the casualty level only. Then we have made that separate wing for them, then isolation area for them. Then from the biomedical point of view, what we have done is that we have given extra ECG, DFib machines to the department so that they don't have to, someone has to enter there in that COVID areas. Now, what is important is that, so what we have done is that teleconsultation. The advantage of this teleconsultation that even if you say in Mumbai currently also 30% of people are still working from home. For them, this teleconsultation has really given a chance that from their comfort of home, they could able to communicate with our doctors. We have seen general physicians, diabetics, and the main important is the psychiatrist. Like it is observed that the young generation is very well comfortable with the on the tele-OPD consultation. And during this everything, we have seen that this everything we have done in April, and in first or second week of April, we realized that still there is a lot of stress and anxiety between our own employees. So how to take care of that? So what we have done is that we have done a consultation with the physician on WhatsApp or teleconsultation. So we have used some digital technology there. Then for our own staff, we have given immunity, nutrition, vitamin D, vitamin C tablets so that they can able to improve their immunity. Then we have done a breathing exercise technique for them so that they can able to increase their immunity. Then we face a problem when there was sudden shortage of the manpower. Now, how to do the interviews also? So again, the technology has come into picture, like Skype was used for given the induction. Also, we have used some videos for that so that they can able to get induction without 1:1 communication. Now, important thing is that if you see that in March 2020, there were only 26 NABL labs in across India. And down the line in May, it is around 1320 labs across India. So what is the advantage is that this time we have seen that NABL accreditation has happened online. And I think that is the biggest advantage to do the COVID test across India. And this was a really good thing which has happened. Now, in our hospital, we are having paperless ICU. It's always easy for the nursing staff to spend less time on the documentation care, and they could able to spend more time on the patient care. And similarly, when all these things were going on, there was always issue of supply chain. Suddenly, there was an increase in the demand and the consumption, and because of lockdown, the raw material was there in their stock but could not able to get out. So we never used to get a good product. So prices has increased almost 200%. The consumption has increased 3 times, and to overcome that, we have to pay extra for that. But we have to make sure that the part available. Now we have seen that down the line, now reopening as supply chain is happening, and because that we will get advantage to take care of all these issues. But and one thing is important that down the line we have seen that in last 4 months that there are a lot of local products are coming. So now we have to be vocal about our local product which we can use it. So we have seen that on personal front. Last 3 months, I could get a chance to work on the first field hospital across India, the fastest hospital which was done in BKC. So I can say overall, it's teamwork. We can able to fight with COVID, and the communication, cooperation, and the coordination has given us success for them. Thanks, Dhan.
Well, very well said. And I liked your idea of that SMS, what you mentioned. That was a wonderful thing. And then taking care of the employees first, the care team first, and then taking care of the patients in terms of the footfall, the communication, etc. I think that was something which are the key takeaways and wonderful ideas you guys have executed. So thanks for sharing your thoughts on this. So let me now quickly move to Mr. Abdullah Salim, the Group CIO, Omni Hospitals, to share his thoughts on this subject, please.
You are on mute, Salim.
Salim?
So for the reminder, thanks a lot. I'm sorry for that. I think this is a great topic what we have got to speak about today. I remember that almost 13, 14, 12, 13 years ago, we started talking about in kind of a change management, especially with the RGCI to adopt the technology towards the better patient care and patient experience. But nevertheless, the adoption was a key challenge. But this COVID era has given the great platform in terms of the management from the patient perspective and the doctor perspective, and then they have understood that how the patient engagement is supposed to be put in place. So I think two of my friends have already covered that why the technology and the without technology we cannot move ahead. Without technology, we cannot raise the cost of the organization. Without technology, we cannot give the confidence to the doctors, patient, and the paramedical staff. So recently, couple of during the every hospital has the struggle and their revenue gone it got a drastic dip down, and then the organization took a decisions and taking the advantage of this demand from the doctors fraternity to implement the technology. So just I'll highlight that after the technology adoptions, what we have achieved. And these were the goals, and what we have achieved by now after the putting the technology in place across the Omni group of hospital. Uh, if you talk about the patient perspective, the technology has increased the patient understanding, and it has given the whole patient care and support at their fingertips. The nurse wide flow of the services we have enabled, active monitoring and assessment. Again, it was not possible without this technology. Reduction in emergency visit and readmissions. Again, it has been reduced, and well coordinated and efficient the process what we have put in and deployed and got implemented and got the expected outcome on that. If we talk about the caregiver perspective, it is oversight assurance we have enabled, effective communications we have enabled, COVID-19 specific support we have enabled to the risk. My friend has talked on the KIMS hospital, Dr. Uh, uh, from that perspective, we have put in that COVID-19 support and given the support, confidence to the paramedical staff to take charge as earlier. And the last one was I'll say that the improved competence for the caregiver side. If we talk about the doctor side, what are the technology has enabled for us? What we have done at the group, the improved patient compliances, and it has enabled the doctors to the data research and analytics, which was very, very important for them. And this elements has given more confidence to the doctors to come on the technology and adopt the technology. And this is the element has given more confidence in terms of the doctors, the understanding to the doctor's fatality that yes, this is the technology is going to add value in the circumstances, and they have agreed on that. The next one was the pre-hospital care plans and assessment, which was enabled by the doctor's perspective. Post-hospital care plan also, which has without technology is a very, very important that we say that geriatric, which combines the home-based treatment after the post-discharge of the patient. That also this technology has enabled and given the confidence to the patient, the doctor as well. And the optimal care services we have enabled for the doctors. Reduce burnout is another important thing we have reduced after this technology implementation. And the next one, the last one for the doctors fraternity, what the technology has given that interactive doctors dashboard. Interactive doctor dashboard, again, this is one of the important elements for the doctors to win their confidence. Hospital perspective, what was the hospital perspective we have achieved after the technology deployment? Operational excellence we have achieved. What was earlier and what is now after technology is way difference. Improve patient outcome. It has been the hospital always look for the improving the patient outcome. That also we have achieved. Seamless transition of care. The hospital perspective, the organization perspective, always worried about that. And once the doctors came on the board, the hospital achieved this goal as well. And care continuum we have achieved up to some extent, of course. And comprehensive coordination approach we have enabled within the doctors, patient, medical staff, and the back office staff as well. And last but not the least, for the organization, which is very important, that is brand loyalty that we have achieved on the technology perspective for the organization. So these are the highlights which I've given, which we have achieved at the Omni Group of Hospital for the past 3 months. And trust me, it has helped a lot in terms of improving the top line and the bottom line. And bottom line cannot be improved until unless the cost optimization is done. And if the technology was not there, it could have not been possible. So that's the where I would like to add, and I hope we will be continuing enhancing and putting the lot of learnings in the technology perspective for the organization. And of course, this is the perspective which we have set and to which we have put, and it is not going to enforce that we have to go way back again and do whatever we have done in our business run in the past. So it is not possible to go back again and leaving this technical approach, technology adoption across the organization.
Great. Wonderful, Abdullah. So I think the key points what you mentioned is that I think your the dashboard for the doctors adoption. I think that's one important area what I can understand. Interactive dashboard. That is what you mentioned about, and also that seamless transition of care. And finally, you mentioned about the cost optimization. So I really appreciate these efforts, and every other hospital have actually done lot many things on the cost optimization. So thanks for sharing your thoughts on this. And now let me move to Mr. Harmandeep Singh. He is a Vice President of IT for the Rainbow Hospitals to share his thoughts with us.
Good evening, everyone.
Good evening.
We are into a hospitals business, as my other panelists are, but we work with pediatrics as well as OBGY. So we work with a baby who is just a few hours old to a 18-year-old kid who's just going to be adult. So our patient base is very dynamic. That's how our business is defined. And our journey started much before the actual lockdown happened. We were very proactive, specifically our senior management team and our materials team were very proactive in identifying that what all could be the impact if this kind of a scenario hits our country, which ultimately did in the end of the March. So in February only we had done a lot of supply chain analysis and see where are the gaps and where we could face challenges, because we are a multi-city based organization wherein we run a central supply chain system. So even though we may have the materials in one unit, it could be a challenge for us in the future to move them to different units. So our journey started then. But when the actual lockdown hit in the end of March, the biggest impact was that there was a lot of fear in the general public as well as within the organization, whether it is your doctors, nurses, paramedics, your housekeeping staff, your security guys, people like us who work in the IT. Everybody was fearful. And there was a lot of panic also, I must say that. People were not aware. They were clueless, honestly, if you ask me, what to do. And the situation was very fluid. The situation was changing by the hour. So first thing we had to formulate as an organization was to have a war room, because this was a war kind of a scenario, wherein the senior leaders who are the decision makers need to meet on a constant basis, sometimes multiple times during the day. Because we all sit in, all the senior leadership sits in one office, so we didn't have to formulate something like a WhatsApp group. But yeah, that was something which was very much required for that situation at that time. And the primary thing which we had to set up was that we had to remove this fear. We had to come out with some actual confidence building information for our employees. There was a lot of social stigma. People were not turning up to the hospital. Their parents were calling up the HR and asking that they can't report to office. And we also took a lot of measures. Our HR was very proactive. And then even before the lockdown, they had set up shift patterns. Although as a hospital, you follow shift patterns, but they were fine-tuned and people were given more options to work from home. Although as a hospital, you don't have much of a work when you work from home, but depending upon your workload and the department you're working on, we followed a hybrid model. during the first and the second lockdown, wherein people were working from home, people were coming to office, people were not contacting each other, even though you are working in the same department, your shifts were different and things like that. So basically, what I'm trying to say here is that in such a situation, you have to formulate a communication channel, whether it is with your employees, whether it is with your patient, whether it is within the employees, which is very important because, as everybody knows, every day WhatsApp was getting flooded with, and all this social media was flooded with wrong information, which is aggravating the panic. So we, as a hospital, we thought that our primary responsibility is to first reduce the panic within the employees and the patients. Now coming to the patient side, so the first thing which we observed on 27th or 28th of March was that our communication with the patients was lost. We didn't had any telemedicine platform because we cater to small kids. So our culture was that they have to be brought to the hospital in case they have to be treated or vaccinated or they have to come for regular checkups. So we had to really think on our feet. And within the next 3 to 4 days, our IT team as well as one of our partners were able to set up, formulate, set up, and go live with a rudimentary telemedicine platform. I would say that because we have fine tuned it vastly since then. Thanks to UPI, we were able to set up the payment gateway also very quickly. And we set up a multifold communication channel with our patients. When I say multifold, one was through emails. We had an email desk wherein emergency doctors were replying to certain emails from patients. Second was a teleconsult, wherein people were just calling our emergency department and there they could talk to a doctor, get their basic queries answered. And then from there, they can be routed to either a specialist doctor or their query gets answered or they were being asked to come to the hospital. And third was obviously the video consult, wherein the people can book an appointment, consult the doctor, share the reports, and then the doctor also prescribes and then the prescription goes back to the patient. So this platform has really helped us to keep that communication going. I think communication was one of the key challenges there, and going further when the lockdown kind of opened up, that we all had thought that once the lockdown gets over, things will be rosy, people will start coming in, and during the lockdown, we had an impact of almost 60% of our business went down. We had good numbers in the IPD, but our OPD footfalls were almost 60 to 70% down. Though in the OBGY, we were getting a lot of business in terms of deliveries. Our delivery counts actually went up than our budgeted numbers. I can share that. So that kind of helped us to maintain afloat during those days. But once the lockdown got over, we also thought that things will be rosy and things like that. I think for us as an organization, the actual COVID hit that time when the lockdown got over, because we all were thinking that it will be a status quo, whereas that didn't happen, and that is the time when we really starting evaluating our processes, our procedures, both technologically as well as otherwise. And we launched a home care package wherein you can buy a home care package from us, and we will be giving a kit out to the patients, and then there is a continuous monitoring by the nurse and a doctor during the day, and you get certain sort of consults, efforts within that package, medication and other stuff. At the same time, we launched a home vaccination program for our kids, because a lot of people were calling in, inquiring about vaccinations. Because from 0 to 6 months, a kid goes through a lot of vaccinations, and they can't be preponed for like 4 to 6 months. Postponed, sorry, not preponed. So I think that is the time. These are the few technological solutions which we adopted, and I must say that we are currently in the progress to improve on those and come up with different versions. And we as IT took the staggered approach of phase manner delivery, because you can't go for perfection. That's what I've learned in my entire life, that you have to build your IT project into phases, and that has kind of really helped a lot. And even from the management point of view, they were, I would say, I can sell any digital platform more easily today to my management than I was maybe 7 8 months back. But that doesn't mean that I should sell all the crap to them. So now my role has become more important, that I have to deeply evaluate the technology and see how it gets aligned to our organization's roadmap going further. And I think it is going to be a very challenging times for a CIO, wherein every partner is coming up with some sort of a digital solution. So yeah, your goal is to be really to identify what is going to fit for your organization and how you are going to take it further. I think that's it. What I would like to share for now.
All right. Thank you, Harman. And I think the quick point, what I noted from your conversation is that I think that war room creation and the communication channel, the arrangements, what you made, I think that was one important takeaway. Uh, and the second point what to mention is that yes, the people will or the vendors will come with different solutions, but then what works for the organization, what works for us, what works for the situation on ground, and which business challenge you are trying to address. I think these are the key parameters to understand before you apply any technology on the business scenarios. So thanks for that share. It's wonderful hearing that. So let me now go to Mr. Jayaprakash Dwivedi, CIO, Rajiv Gandhi Cancer Institute and Research, Delhi, to hear about his thoughts on this particular subject.
Thanks, NK, and thanks organizers to give me this platform to speak with all of you. This pandemic has really taught us a lot many lessons. We as an organization have been thinking about this telemedicine aspect for quite some time, but we never really gave it a priority. We thought as a cancer institute, we are either performing surgery or giving radiation or administering chemotherapy. And none of them can happen over a video conference or remotely. So there was hardly a case for us to really focus over telemedicine. But this is such a time that you see, normally, if you look at statistically, whenever there is a downturn in the industry, there is upturn in the healthcare. So healthcare organizations have better top lines, bottom lines when there are problems in the industry. This is the first time that in this situation, healthcare is affected even worse than other industry segments. People are letting go, doctors, nurses, paramedics. Beds are less than 50%, less than 30% occupied unless you are a COVID hospital. Suddenly we realized our patients were calling doctors over their mobile numbers, personal contacts, their OPDs. They were not able to leave their homes. They were not able to come, and they wanted their help and services. So we realized that telemedicine is something that we really need to very actively pursue upon. Now, as Harman said, there are plenty of solutions, plenty of telemedicine platform providers, but then all are running on their own islands, having data somewhere in some cloud. And it has nothing to do with our databases, our HIS, and we cannot really connect history with the episode that we are going to conduct. So we needed an integrated kind of solution that we should seamlessly be able to work, and we should be able to see the history of the patient and then record whatever is being given, prescribed electronically. So very first thing, without having any system, what we did, we just opened our payment gateway and just asked patients to pay the consultation fee over the website. And then in the back end, we just channelize it to the doctor, and somebody who is telemedicine coordinator, goes to the doctor, arranges the video conferencing over WhatsApp. Very primitive technology, just a rudimentary practical solution. And at least we started communicating with our patients. Then the very next step we did, worked upon with the telemedicine app that our HIS provider had. It was not suitable for our environment, but we just used a small portion of it. Now the problem was that, once we enable a telemedicine app and we are allowing patients to enter into our environment and integrate with our production database, now we are actually opening Pandora box of the problems related to security. So we had to deploy this on a cloud and build a fabric of the security that allowed very limited and controlled replication between the cloud and our database. So at least we enabled the repeat patients who can system understands them. So we just through all their lab reports, radiology reports, or past record to the patient's mobile so they can see, and then patient can pay online for the repeat consult or to our doctor. Then we realized that more than repeat consults, actually the new people who have been diagnosed with cancer, they are more eager and more keen to consult our doctors. So we had to enable the document upload and patient online registration process. So that application was enhanced further to enable the patient registration process. The patient is registered online, and then patient can upload all the reports that the patient is getting from the local lab. So first time he talks to a doctor, doctor will say, get these initial investigations done that otherwise patient would have taken in our hospital. The patient will get those investigations done in some local facility and then upload the reports there. And then in the second consult, doctor is able to download the reports online and is able to see and is able to prescribe further course of action. Now, if the intervention is inevitable, it is needed, obviously the patient will have to come to get the surgery done. But a lot of things, including pre-anesthesia checkup, could have happened there itself, so that patient comes and without much ado, patient goes to the operation theater straight away. So that way, we were able to help a lot of customers, a lot of patients in at least initiating their treatment in a timely manner. Because in case of the cancer, you see, time is of immense sense. If you lose 1 week, second stage cancer may become third stage, and it's kind of life threatening. So this taught us that even without having readily available full technology landscape, we can evolve and we can use it at least component by component as is available and put it to practice. I was in a panel discussion yesterday where the keynote speaker made a fantastic statement. He said, what is innovation? So the real innovation is technology is available everywhere. Those pieces, components, those pockets of excellence are there. Real innovation is how you pick them one by one and actually put them all together in your particular story and make use of whatever is practically available to you. So that is how we learned, we evolved. And as I'm talking with you, 60% of my team is COVID positive. And they are either in hospitals or at home. Had we not been prepared to gain connections with laptops, and those are real warriors who are still working in spite of being hospitalized or being infected with COVID, they are still doing whatever bit they should do or they can do. So that makes us special as an industry, as a real responsible elements of the society.
Wonderful. So I think I'm really delighted to hear a couple of things from you, Mr. Jaiprakash, and You mentioned about quick opening of payment gateway solution to get the payment, and then third party to manage on your telemedicine stuff. What is more important, I feel, is that you said towards the end of your conversation that component by component use of what you need, rather than waiting for taking a complete suite and then integrating the whole thing with all your technology things. I think that is remarkable. And especially you mentioned 60% of the team is a COVID positive, so they are under treatment. And I'm sure now all of them are, safe and they are out with, good health. So I think that's the key takeaway. So thanks for sharing your thoughts around this. And with this, we come to the second part of this discussion. And we have roughly around 10 minutes left. So my humble request to the panelists is that try to be more specific and crisp on this particular point. This particular question is very, very known to all of you, and you have already spoken on many forums. So how this new technologies like the robotics, the AI, the IoT, the wearables. If you guys are having some use cases in your industry, in your hospital, if you can share your thoughts on these technologies, okay, AI, IoTs, and wearables, how they are playing an important role in your organization. So your thoughts, please. Maybe 2 to 3 minutes quickly, each one of you. So let me again now reverse the flow. I'll start with Jay Prakash, and then I'll go reverse in that direction.
And I'll just quickly intervene for 30 seconds. I'll request you if we can wrap the session in next 10 minutes.
Okay, yes, we are going to do that. Yes. Yeah.
Sure. So, NK, we have been using robotic surgery for last about 9 years. We were one of the pioneers in using Da Vinci robot. So this was the first use of robotics in hospital setup. And we were one of the first organizations who used a robotic arm to actually print the CDs after the radiology examination. So it could churn out, a bunch of CDs in one go. Then we started fiddling with technology in little advanced interventional radiology areas, where we were giving, very precision chemotherapy and radio frequency ablation and those kind of interventional radiotherapy areas. Then we started using AI in advanced radiology. So the very first use case was lung nodule detection. So there is an MRI or CT, and then applying this particular software can much more effectively read. So of course, initially the radiologists started feeling threatened worldwide, but now their roles are changing. So technology is really assisting them. And the latest is about texture analysis, that we are talking about the digital pathology, the real digitization of our tumor bank. So we are actually experimenting with technology in many, many areas, including diagnostics, therapeutics, procedures, everywhere.
Wonderful. Thanks for that quick input on that. And let me now go to Harmandeep Singh. Just within 1 or 2 minutes, quickly, if you can just share the areas.
Yeah, as far as artificial intelligence and machine learning is concerned, we already started the journey before the COVID hit in. So basically, we are trying to use machine learning in terms of our OPD prescriptions so that we can help our doctors to key in the data quickly and churn out a prescription for the patient on a quick basis, because on an average, our patient time with the doctor is not more than 2 to 3 minutes. And if the doctor spends 1.5, 2 minutes on just writing the prescription, it kind of reduces the number of patients they can take care of. So our focus is that a doctor in a day should be able to maximize the patients he can provide the care to, because in our country where there's a lot of shortage of doctors and other stuff, this is very important. Second, which we are working on is towards next level of a digital ICU, wherein all our ICU equipments are integrated, feeding data into a central system. Nurses are already entering the charting data into the system, and then the system has a backend machine learning or an AI engine, which kinds of understands the data and then comes out with very basic outputs for a doctor. It's a suggestive output for now, which we are using in one of our units. Once it is streamlined, then we will be moving to the other units. And the third technology which we are using is RPA, which is everybody is using, but basically we are not using it on the clinical side of it as of now. We are trying to streamline our back-end operations. And I must say that we, in department like finance and HR, we have been able to
Support
optimize
functions, basically.
manpower by 20 to 30%.
Okay,
So,
great.
in
Wonderful.
short, these are
So,
the three things.
yeah, wonderful. Thank you so much. So let me go to Abdullah. Quick 1 minute, please, if you can just share your thoughts. Abdullah?
Okay.
Okay, so we'll move.
So quickly, in 1 minute, I would like to say that recently AI and machine learning we have introduced, whereby
Yeah.
it has helped all the follow-up will be done remotely, and in case of the first follow-up, also the based on the AI chatbot AI, the appointment is booked by based on the assessment of the self-assessment and the self-assessment that the doctor has been identified and it has been booked and the consultation is done and the patient has got the prescription and they started medications. So without zero intervention of a human there in this AI and machine learning has helped to improve that unnecessary bringing the crowd to the hospital, and those people who are really needed for the hospital to come down, they can come, and the fear between the doctor and the patient is also has been mitigated on a large scale, and that has helped to the patient and the doctor both.
Okay, great, wonderful. So we have just 2 minutes left. So Nilesh, you have 1 minute.
Yeah. So on Independent Day, PM announced that National Digital Health Mission. So it is digital era is going to be there, and what are things are going to help them in doing that is what the artificial intelligence. Artificial intelligence we are using in X-ray machine, which has given advantage of checking advanced pneumothorax, and that is really helpful in case of COVID detection. And in CT scan machine, there are a lot of radiation doses to reduce the radiation and contrast media. There is artificial intelligence has been used. Then we are having a COVID war center. If you see all the field hospitals which has been developed recently across India in Bombay, where a lot of things are there. There is a COVID war center where intensive service is sitting in one location and taking care of around 1,000 patients in one location. Now there is internet on medical things. So like digital ICU, a combination of LIS, HIS, as well as you can say good EMR, which is always going to give you the good data for like length of stay, mortality, everything for the patient. So all these things are available along with the home health. It's a real new trend which is going to come. And robotic, yes, it is making a difference for the precision of accuracy. Thank you.
Great, wonderful. So let me go to Dr. Naresh.
I'll just, in the interest of time, I'll go a couple of things to. One was the telemedicine platform which we're using to consult patients. It has an AI-based engine which gives doctors, depending on the symptoms or depending on the data which gets included into the platform, the solution is helping them to arrive at a better decision. That is where we are trying to kind of use AI into the whole delivery of services. The other point which we are still not live, but still we are trying to explore is use of IoT devices on the biomedical equipment to solve a use case of to understand how many hours was each equipment used for which patient, to ensure there is no revenue leakage as such by using these equipments. So those two areas which
Thank you so much. So with this we come to the end of this panel discussion. I think if there are any question answers, we can proceed for the next 5 minutes, or I just send it over to the organizers.
I think it was quite an insightful panel discussion on the changing phase of Indian health tech in the new world order, and what is the present situation and what is the way forward. And I thank Mr. Nand Kishore Dhomne, Mr. Dr. Naresh Yagada, Nilesh Shinde, Abdullah Salim, Harmandeep Singh, and Jay Prakash Dwivedi for joining us on this very important subject of uh, healthcare transformation to technology. What are the challenges? What are the way forward? If I can sum up the discussion, I might say that it's all about upgrading your tech infrastructure, but which solution to choose depends on what kind of infrastructure upgradation you want. I think that has been a lesson of this pandemic, and I'm sure in the coming months, coming years, we'll all will be upgrading our IT infrastructure according to the need of that particular hospital infrastructure, but also keeping in mind the new redefined aspect of demand from uh, operations in the pandemic and post-pandemic era. Thank you so much for wonderfully moderating the session, Nankishore Dhomne, VPIT, CIO, Manipur Hospitals, Dr. Naresh
My
Yala,
pleasure.
CIO, Keams Hospital, Nilesh Shinde, CDO, Jupiter Hospital, Abdullah Salim, Group CIO, Omni Hospital, Harmandeep Singh, VPIT, Rainbow Children's Hospitals, and Jay Prakash Dwivedi, CIO, Rajiv Gandhi Cancer Institute and Research Center, Delhi. And let me also inform you before we wrap up this session and conclude, two-day Global India Healthcare Conclave organized by APEC Digital News Network, that we will be coming up with the second edition of this prestigious knowledge sharing platform on 27th and 20th October. Again, I am mentioning the second edition of Local Healthcare India Conclave will take place on 27th and 20th October. Let me sum up also by informing you all that for 2 days we have got registration of more than 1,000 delegates. Uh, Entire happening has been broadcasted live through Facebook, in Facebook and YouTube through Application News Network, and multiple government agencies, hospitals, health tech companies have also reshared our live broadcast to reach out to more and more people. With this, again, I thank all of you for joining us in 2 days of local healthcare India conclave organized by APEC Digital News Network with an aim of creating a knowledge sharing platform to discuss and deliberate upon various aspects of effective healthcare ecosystem to take India's healthcare innovation to global arena. Let me also take this opportunity to thank our partners, our government partners, Department of Science and Technology, Digital India, MyGov, National Informatics Center, PSU partner ACC India Limited, Gold partners Innovatage and Medall, associate partners Godrej Appliances, Crackman, Omni Hospitals, MBS Today, institute partner IIHD India, and investment partner India Healthcare Angels. With this, I again thank all of you for joining us today. See you on 27th and 20th October in second local India Healthcare Conclave. Thank you so much.
All right. Thank
Thank you.
you. Bye bye.
Thank you. Bye.
Thank you.